My name is Andrew Malin. I'm an orthopedic surgeon with Riverview Health. I specialize in the treatment of hip and knee arthritis, including performing hip and knee replacement procedures. I have about 15 years of experience as a practicing orthopedic surgeon. I also trained in surgery for 5 years, so I guess a total of about 20 years, including training of orthopedic surgery. Well, I perform over 300 joint replacement surgeries per year. I've now been working with Riverview Health for 4 years. Prior to that, I was active duty in the Air Force, where I worked as an orthopedic surgeon as well. So this is my first job outside of the military. We settled here about 4 years ago with my family. We've had a great experience with work and life in general. I joined the military out of high school when I attended college at the U.S. Air Force Academy. So I spent 4 years there, and we kind of went through a normal academic program, did our military training, and then I played football at the Air Force Academy as well. I initially went to the Air Force Academy thinking I wanted to become a pilot, but changed my mind when I was there and decided I'd like to try to go to medical school instead. And fortunately, the Air Force let me do that, and so then I went to medical school outside the Air Force. I went to Harvard Medical School in Boston, and then I did my surgical training at the University of Iowa. After that, I went back onto active duty for 9 years as an orthopedic surgeon in the Air Force. The types of joint replacement procedures that I perform are primarily hip and knee procedures. I think we've been fortunate to have a very strong success rate with our hip and knee replacement procedures. The nature of the surgery is that it tends to be very helpful for patients. Hip and knee arthritis can be very debilitating, and performing the surgery can really improve patients' quality of life. Looking specifically at our numbers, we've had very good success as far as our outcomes. Also, our complication rates, things you try to avoid with surgery like infection, blood clots, fractures, our rates are very low, much lower than the national average. Well, as far as performing joint replacement surgery, we don't necessarily have a strict age cutoff. Now, most of the patients tend to be older because that's when they have arthritis. We also want the implants to last as long as possible, so we try not to perform them in very young patients. As far as the upper end, if a patient's healthy enough to have surgery, if their heart is okay, if they're still active, then we really don't have an upper age where you could consider undergoing the surgery. I've done elective surgery in patients in their 90s. But certainly as patients get older and they have more medical problems, we always have to weigh the risks of surgery against any benefits that they can get from it. The symptom that would primarily cause patients to think about joint replacement surgery is pain. Now, our arthritis is the condition we treat. Arthritis causes pain. It can cause stiffness, swelling, deformity. But in general, it's a painful joint that's going to limit activities, going to allow patients not to enjoy life the way they like to enjoy life. That's when we start talking about surgery. And really, we like to maximize non-surgical treatments first. So if we've gone through the non-surgical treatments, if those haven't helped and they still have pain, that's when we think about going ahead with the procedure. Joint replacement is primarily used to treat arthritis. Now, arthritis is kind of a generic term for loss of cartilage or cushioning of the joint. So when you lose the cushioning of the joint can't move smoothly. There's rough motion that can cause inflammation, pain, and swelling, and that's what we're primarily treating. There are different types of arthritis as well. The most common type of arthritis is osteoarthritis, which you can think of as wear and tear of the joint, and that's the most common. There's also conditions like inflammatory arthritis, such as rheumatoid arthritis, which can lead to deterioration of the joint. And then finally, traumatic conditions can lead to development of arthritis over time as well. An example would be someone who, when they're younger, tears their ACL, goes on to develop arthritis over time, and those patients can potentially benefit from joint replacement surgery as well. The right time to have a joint replacement done is really a very personal decision. I always like to try non-invasive treatments first. If those fail, then I usually tell patients if you're at the point where your hip or knee pain is affecting your quality of life, if you're not able to do the things you'd like to do, in other words, you can't chase your grandkids around the way you'd like, you can't walk your dog at night, can't do certain activities at home, and then that's maybe the time to think about surgery to improve your quality of life. Well, things that can be done instead of surgery for arthritis are something that I always consider. I always want to treat these conditions without surgery if possible. The initial things that we talk about are just a basic exercise program or physical therapy. If you can improve the range of motion and the strength of a joint, that can oftentimes help a lot with arthritis pain. Patients who are overweight, if they lose some weight, and it's difficult to do, but if they're able to, that can help with arthritis symptoms as well. Moving on from there, we'll use medications, anti-inflammatory medications, acetaminophen, topical medications can help. There's also some supplements like turmeric, which can have some anti-inflammatory properties and can help with arthritis pain. And then finally, we'll commonly use injections as well. There's unfortunately nothing we can inject at this point that fixes the problem long term, nothing that helps the cartilage grow back, but injections can provide good temporary pain relief, and for many patients, injections are enough to keep them from wanting to have surgery for many years. Well, as far as the surgical procedure is concerned, I'll start with discussing a knee replacement. This is a model of what a knee replacement looks like. Now, essentially the point of a hip or knee replacement surgery, or any joint replacement for that matter, is to replace the worn out cartilage, replace the worn out joint with artificial parts. So if we're looking at a knee, you can think of the knee as a hinge joint. Kind of works. It's more of a complicated hinge joint with some other motions as well, but can be thought of as a hinge. And essentially what we do during surgery is done through it's an open surgery. We make an incision, and then we're basically going into the knee. We're taking small cuts of bone from around the knee and replacing it with these metal and plastic components. So again, the replaced knee kind of moves in that manner. One thing I'd like to highlight is some of the newer technology that we're using with knee replacements at this point. And one thing that we've incorporated in the past several months is robotic technology. It's a little misleading in that a robot's not actually performing the surgery, but it acts as a guide, and it allows us to be very, very accurate with how we're making our bone cuts, how we're sizing our implants, and also how the tension or how the knee basically works with the implants in place. So that's been very exciting technology for us, and I think it's hopefully going to make what's already a good surgery even better for patients. Now the hip it can be thought of basically as a ball and socket joint, as an example of a hip joint. And what we do with the hip replacement surgery is essentially replace the worn out ball and socket with an artificial ball and socket. There is a metal implant or titanium implant that goes down into the bone. It has this porous material, which basically allows the bone to grow into the implant over time. And then there's a ceramic ball. And then on the cup side, there's a metal titanium shell, which also grows into the bone over time, and then a plastic or polyethylene liner. So the joint essentially looks like this when it's replaced. Highlighting a few newer technologies in hip replacement that we're incorporating, there's different ways to do a hip replacement. You can put the incision towards the back, towards the side, or towards the front of the hip. The newer way to perform this surgery is what's called the anterior approach, or with the incision in the front of the hip. The advantages of the anterior approach are that less muscle is injured during surgery, which makes for a quicker early recovery, and it's also less chance of complications such as dislocation after the procedure. Also, I incorporate technology in performing hip replacements as well. We use a specialized table to help facilitate this anterior approach to surgery. And also I use a navigation system called RadLink, which again allows me to just be very accurate with how I place the components during surgery, and accurate in restoring the patient's leg length, again with the ultimate goal of providing the patient the best result possible. I'd like to think there's some unique aspects that we offer patients with respect to the care we provide. First of all, Riverview Health is a smaller, community-based hospital. Care a lot about the community, are a part of the community, and I think the advantage there is that getting care at our facility, you get personalized care. We know who we are. We really take pride in knowing about our patients, knowing about their lives, and how we can hopefully help improve those lives. That being said, although it is a small facility, we do offer state-of-the-art care as well. Since I've been here, everything I've asked for as far as new technology, new equipment, no matter how expensive, I've been able to get those things. And so we just talked about the technology aspects that we're using in the OR, but I think we're able to combine personalized care with very state-of-the-art high-tech care as well. The risks and complications associated with hip and knee replacement are very rare, but the risk isn't zero, so it's always something that I talk about with patients prior to surgery. One of the main things that we worry about is infection. The rate of infection is less than 1% following these procedures, but if an infection does happen, it can be a very big problem. It's very difficult to eradicate that and to get rid of infection after these procedures. Fractures can happen during surgery, blood clots can happen after surgery. There can be medical complications, with related to heart conditions or other medical conditions with the procedure. procedure as well. So we do everything we can, of course, to minimize these complications. Some of that involves just the work I do and making sure I'm doing very efficient, clean surgery. We also try to modify any patient risk factors prior to surgery. So in other words, if a patient has poorly controlled diabetes, it's very important to make sure that medical conditions like diabetes, heart conditions, other things are optimized prior to performing surgery, and that minimizes our risk of complications. A typical hip or knee replacement surgery takes just over an hour to complete. If a patient is fearful or hesitant to undergo joint replacement surgery, first of all, I tell them it's very normal to be nervous or anxious prior to a major surgery. I think the most important thing is, as far as relieving some of the anxiety or making the patient feel more comfortable, is education prior to the procedure. We take pride in educating patients through several means prior to the procedure. I'd certainly talk with every patient in the office, explain the procedure, and answer any questions that they have. My nurse practitioner will do the same thing as well. And then we also offer a joint replacement class. So our nurse navigator runs that class. They'll be able to go through the whole process, answer any questions, and there'll probably be a number of patients in that class as well, so I think it maybe helps some patients to just have that sense of community or the sense that other people are undergoing the same procedure. Another thing I think is very important as far as minimizing the anxiety with surgery and just getting the best result possible is having support at home, having someone to kind of coach you through the process. Because there can be difficult days in the recovery process, days where there may be more pain, and to have that support at home is very important, I think, as far as getting the best result possible and making the experience as good as it can be for the patient. I think it's very important to talk with patients about expectations after joint replacement surgery. For a patient that has severe arthritis in their hip or knee, I think joint replacement surgery can reliably be expected to improve their pain, improve their quality of life, and so I think that's a good thing about what we do, about what we can offer. That being said, I think expectations have to be realistic as well. After hip and knee replacement surgery, there should be very little to no pain, but it may never feel like a perfect joint, it may never feel like your knee when you're 18 years old. As far as getting back to certain activities, low impact sports are great with a knee replacement. If people like to play golf or pickleball or swim, bicycle, hike, any of those things are very good with a joint replacement. But getting back to impact sports where there's running and jumping, probably isn't very realistic for the most part after a knee replacement or hip replacement. So I think the patient having expectations of what they want to accomplish and make sure that those align with what the surgery can actually do for them. After a knee or hip replacement surgery, pain management is a very important aspect of the recovery. There's been several developments over the past 10 to 15 years as far as pain management after surgery that can be very helpful, specifically looking at multimodal pain management, in other words, treating pain from various different perspectives. Traditionally, we'd often use a large amount of opioid medications, which can be addictive, can have side effects. Now we're really trying to use less of these stronger pain medications, but we're trying to substitute other methods of controlling the pain after surgery. One of the things is using anti-inflammatory medicines, acetaminophen, steroids for a short period of time after surgery. Also, we do a number of blocks during procedures to help with post-operative pain control. One of the unique things at Riverview Health is something called cryoneurolysis, which the anesthesiologist will do prior to knee replacement surgery. This deadens some of the nerves in the region of the knee and helps with pain after surgery. I also do injections during the procedure. So I think pain can be expected after surgery, but there are a lot of developments to make it as less as possible and to facilitate the recovery. After joint replacement surgery, almost all procedures are considered outpatient at this point. That being said, a lot of patients will stay one night in the hospital. I'd say about half of my patients right now will go home the same day, and half will stay one night in the hospital after the procedure. Now, some patients, if they're prior to surgery weren't walking as much, or older patients may stay longer than that or may go to rehab. But there's been a lot of developments recently in that most of the patients can go home the same day or the next day after the procedure. Physical therapy is a very important part of recovery after hip or knee replacement surgery. All patients in the hospital the same day of the procedure will have physical therapy. They'll be walking the same day of the procedure as well. I think that comparing knee replacement with hip replacement, physical therapy is a lot more intense after knee replacement. Typically it's about 6 weeks of some type of physical therapy, whether that's in the hospital, home health, or outpatient physical therapy. The important thing is to work on gaining range of motion and strength after the procedure. Hip replacement, on the other hand, tends to be a little quicker, easier recovery than knee replacement. There isn't quite as much intensive physical therapy required. Most of the time, if the patient can just walk several times a day, that's about all the exercise you need after a hip replacement surgery. After joint replacement surgery, I talk to patients about phases of recovery. The first 2 weeks after surgery, the patient is mostly at home. You're able to get around the house, you can walk back and forth to the bathroom, can get up and down stairs if you need to, but probably not doing a lot outside the house as far as walking any long distances or going back to work. At the 2-week mark, most patients are mostly off of pain medications and can start thinking about driving again. If they're going back to an office type of job, that's typically possible around the 2-week mark following surgery. I always counsel patients what they can expect as far as longevity of the joint replacements. Now, typically what I'll tell patients at this point is that 20 years is a reasonable estimate. That being said, there have been a lot of developments in hip and knee replacements, so I think it's realistic to expect that the joint replacements may actually last longer than that. A few developments specifically to hip replacement surgery. As I'd mentioned previously, these metal implants are porous metal where the bone will grow into the implant over time, and that makes loosening very unlikely over time. The other major development in hip replacement is our bearing surface. The bearing surface is basically what the ball and the socket that rub together. The ball we typically use is ceramic, and then the socket is a plastic or polyethylene material. There's been developments in that plastic that make the wear rates very, very small, very, very low at this point. So, we don't know for sure, and we won't know probably for another 50 years how long some of these newer implants will last, but I think many of us are optimistic that some of these implants now are very long lasting or even lifetime implants that we're putting in. It is possible that hip or knee replacements will have to be redone in the future. Typical modes of failure would be loosening of the implants over time or wear of that plastic component that's in both hip and knee replacement surgeries. Also, sometime much later after surgery, there can be infections. If infections get into the blood, it could get into the joint replacement as well. So all those are reasons that a hip replacement or a knee replacement could have to be redone over time, and I do perform revision surgeries as well. As far as risk factors that could make a joint replacement more likely to fail, again, we think these implants are good and durable implants that we're putting in. However, patients who have joint replacements when they are very young and active may have a higher chance of that implant failing over time. Also, we again don't typically recommend high impact activities like running or jumping, and so a patient who is very, very active with their implant may have a higher risk of loosening or wear occurring over time.